Hello, it's Dr. Gay from First Look MRI, and this is a 17-year-old male who twisted his ankle, has ankle pain and swelling laterally, and on this view, this is called an axial view, where we can see the front of the ankle here, the foot, here's the back of the ankle, the Achilles tendon. This is the lateral side, the outside. We see this bone called the fibula, and this is the medial side of the ankle. We see the tibia here. I have some arrows on an abnormal finding, but if we go down distal into the distal ankle here, we look at the tendons called the anterior talofibular ligament and posterior talofibular ligament. There's a ligament right here, comes off the distal fibula, and it goes to the talus. And this is the most commonly torn ligament. Almost all the time, if someone has a lateral ankle sprain, they rupture this ligament right here or sprain this ligament. Again, this is called the anterior talofibular ligament, because there's a talus and fibula. And there's another one here. It's called the posterior talofibular ligament. It comes off the back of the tibia over here to the fibula. This is really strong. It's almost never torn. So on this one, this is where we look to begin with. We see ankle swelling over here on the lateral side, probably just a typical lateral ankle sprain with lots of edema and swelling. And we look here and say, wait a minute, this anterior talofibular ligament is intact. That's curious. And the posterior talofibular ligament is intact. There's another one that comes off the back of this calcaneus. It wraps underneath here, beneath these two tendons here, the peroneus tendons, and it wraps up. It's really hard to see, but it goes up to the bottom of the fibula. It looks like this one probably is intact. Usually it's not torn unless this one's torn. But these distal ones are intact. These are the ones, again, that are usually injured, or this one here in particular. Now if we go up higher, this is the level of the ankle joint. If we go above the ankle joint, we get to the tibia. Here's the fibula. Now there's another couple ligaments here above the ankle joint. This is between the tibia and fibula. We call these the anterior and posterior tibiofibular ligaments. These are not torn very often, but in this case, I have my arrows here that show, yep, they are torn. Here's a tear. This should come across this black line and attach here. Instead, there's a defect, little gap. This is redundant. Pull back, and there's fluid that goes through that. And again, this one is torn as well. There's even a little bit of marrow edema back here in the back edge. This bright area is marrow edema in the tibia, and that's right where that should attach. It tore off, and maybe the periosteum tore off with it, and you have a little bit of marrow edema back here. So this is tear the anterior and posterior tibiofibular ligaments. And there's one more thing in between these bones. We call it the intraosseous membrane, or syndesmotic ligament, goes between the tibia and fibula. It makes them hold close together, and this little band is part of that, and it looks like it attaches to the fibula, but it does not clearly go over it to attach to the tibia. So it looks like that intraosseous membrane is also torn. So these high structures are torn in the ligaments. The lower ones that are usually torn are intact, and the high ones are torn. So this is what we call a high ankle sprain. So they'll have to be immobilized for a while. Sometimes they can also have a fracture of the fibula, more proximal in the leg, that can associate this type of injury. Now if we look straight on at this, we see the tibia, we see the medial malleolus, we see the fibula. This is lateral where the injury is. We see this talus. This is called the talar dome here. This all looks good, nice congruent joint. There's no widening. And now we're going to look at these findings on this view. This is the posterior talofibular ligament, that really strong one in back. The anterior talofibular ligament is here. They're hard to see on this view. And then the ones that are torn are up high here between the tibia and fibula. Again, this is called a high ankle sprain. We have torn ligaments instead of down low, up high here. The intraosseous membrane goes between here. We just don't see it. It's probably peeled off or stripped off the periosteum of the tibia here. And again, here's the one that's torn in front and in back. So a high ankle sprain, and that's it. Thank you very much.